Good afternoon, I'm Dr. Duke Majan. Our patient presents, he's had laminectomy before, right? Okay, this is our fourth patient today that had prior back surgery. You can see the incision right there. I don't know if you can see that, Henry. But
yes,
he's had prior back surgery and he has horrible back pain. We see a lot of patients like this who have had prior back surgery and have back pain. And the reason why is because the surgery they had does not fix back pain. You see, back pain comes from a disc problem. He has a disc problem, but he also has other problems like his facet joints, sorry, not his facet, but his piriformis, I apologize, and his SI. He's got two discs that are hurting, plus the piriformis and SI. We're going to be fixing his disc today. I offered to fix the other things, but can you please close that down? But he did not want to at this time. Now, Henry, let's talk about back pain. What are the common causes of back pain? I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine touches the vertebral bodies with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. And welcome back. So from our video, we can see there are 30 different causes of back pain. Each one is specific. Each one can be addressed and fixed with the proper surgery. Duke Spine Institute has all 30 types of surgery available. The most common cause of back pain is the disc. Hold on. All right. Yep. And what is causing the back pain is a tear in the back of the disc. You can see the tear this patient has at L4-5 and L5-S1. I just did the discogram to test the discs to see if they're causing pain. The discs were 10 out of 10 pain, severe pain for the patient. So we know now that these two discs are indeed causing his back pain. We're going to fix these discs with our laser surgery, and the pain will go away forever. All right, the first one is the L5-S1. And Henry, let's show the audience how is it that the disc will cause so much back pain.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And you see from the video that the reason people get back pain from a disc injury is they get traumatic injury to the disc that results in a tear in the back wall called the annulus. The tear itself is called an annular tear. Annulus means ring in Latin. Annulus fibrosus means fibrous ring. The fibrous ring around the disc is there to hold the jelly in the middle of the disc in place. We don't want the jelly escaping from the disc. The jelly will escape from the disc when there's a tear in the annulus fibrosus. Trauma causes a tear. The tear is a path of least resistance. Then the patient goes out and bends or lifts or twists, and that bending and lifting and twisting puts pressure on the disc. It forces out through the tear small fragments of nucleus called herniations. If it's a little bit of herniation, we call it a disc bulge. If it's a lot of herniation, we call it a protruding disc or extruding disc. But in the end, all disc bulges, all disc protrusions, all disc extrusions are disc herniations. They're all the same. Just different ways of saying the same thing. All right, any questions?
Yes, we have a question coming from Lord Impaler on YouTube.
Hi there, Roy.
Asking, so my question for what you just said, if the stem cells won't work because I'm kind of in jeopardy of being fused, what's the next step because I'm out of New York? In my claim, as a workers' comp claim, that I'm going to have them do a M5-42 to have them fly me out and pay for everything.
So, yeah, Roy, first of all, I have to know where your pain's coming from. And Roy, you just watched our video. You can see that there are 30 very specific structures that are responsible for back pain, and there are 30 things that cause neck pain. So I need to know where your pain is coming from. And that's not something that you can tell me. It's something I have to tell you. The only way I can tell you is by doing a video conference call while looking at your MRI. So my advice to you, Roy, is my best advice to you and anyone like you who has pain is stop guessing what's causing your pain. Stop going to doctors that don't know how to cure pain. Go to Duke Spine Institute. We know how to cure pain. And the reason we're able to cure pain is we can first tell you where it's coming from. And that requires our examination called the Duke Spine exam. Okay? Duke Spine exam. Now, Henry,
Yes.
that reminds me, we need to talk to Mudasim tomorrow morning. You must bring this up. I've given you a list of things to talk about, right?
Yeah. Correct.
One of them is going to be the Duke Spine exam on the website. Please bring this up.
Okay.
Okay? We need to change it from an R to a TM.
Copy that.
You understand what I'm telling you?
Yep. From copyright to trademark.
You got it. No, from register mark
Register
to
mark to trademark.
Yeah. The reason is to get the register mark, you first trademark, use it, and then you register mark it. We've already applied for the register mark, but we haven't been awarded it. So I think there was some misunderstanding, and they put the R instead of the TM. So please put TM.
Copy that. And then I saw your
That's-
email earlier that we want to mention that to them as well.
I don't know. What's the email? About management?
Yeah, it was about
Maintaining?
exactly correct.
Yeah,
Yeah.
yeah, that's right. So we're going to talk to them about their maintaining our website, which they were supposed to be doing. They're just a bit funny because I've already told them they have to maintain the site. They've already agreed to maintain it. I don't know why they haven't been. Somehow he thought Golden Web was going to be maintaining our site, which makes no sense to me. I think he's referring to Jasper. Remember when Jasper did the CRO
Yeah.
stuff?
Exactly. Yeah.
That's not maintaining the site. That's just making changes to the site. Henry, you ever see the Love Guru?
Is that with Mike Myers?
Where he says TM all the time.
Yeah.
I'm relaying Berndes.
TM. Yeah.
What does TM stand for in the Love Guru? What does it stand for?
Yeah.
Oh, really?
It was just the running gag inside joke throughout the movie.
All right, so we've talked about the 30 different causes of back pain, and to answer the question of our viewer, here's a big piece of herniation. I need to see you on Zoom. I need to see your MRI, and then I'll tell you what's wrong and how to fix it. But stem cells are never, ever, ever, ever going to fix back pain or neck pain, okay? There is no cause of back or neck pain that responds to stem cells for a permanent fix. All these stem cell companies that are selling advertisements trying to get you to go to them, they all know that you're not going to be cured with stem cell treatment. And if you ask them, will you cure my pain? They will tell you, well, it's uncertain what kind of response you'll have, but you should try it anyway. That's code for, no, we're not going to cure your pain. All right? They know it. They just want your money. And my advice to you is stop wasting your money on treatments that don't work. Stem cells don't work, not for back and neck pain. They do help for joint pain like knees and hips, shoulders, when there's degenerative joint disease like arthritis. They do help, but it's always temporary. It's never permanent. If you want permanent joint relief, you have to have the Duke plasma rhizotomy or a joint replacement. Have we shown the audience how the Duke laser disc repair gets rid of the herniation and debrides the annular tear?
We have not. We have shown what causes it.
Let's do
But
that.
yeah,
Let's do that.
perfect.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A quarter-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And you can see from our animation that I use the endoscope to get inside the tear and find the tear. I use the laser to clean the tear as I'm doing now. We call that cleaning a debridement. This is called an annular debridement because we're debriding the annulus so that it can heal and be painless. Right now, this is a very painful annulus. The reason it's so painful is it's got lots of inflammation happening right here. But we're going to get rid of this inflammation. We're going to get rid of the source of the inflammation, and the disc will heal and it will be painless. I've got about 5 minutes or less on this disc, and then we're going to move to the next disc, which is the L4-5. Any questions?
At this moment, no current questions.
Okay. What we're seeing here is some residual fibers of the annulus. You can see those. The laser is removing the herniation from between the fibers. That is the source of the pain. The herniation there between the fibers elicits an inflammatory response. The inflammation aggravates the small pain nerve fibers that are located in this area and causes back pain. That's discovered by Duke Spine Institute. We're the first in the world to discover that and talk about it, show the public it, publish it, so people can understand what's actually causing their back pain. Because you're not going to get that information from other doctors. Other doctors are absolutely clueless about what causes back pain. That's why they're not able to cure back pain. Only Duke Spine Institute is. Any other question?
At this moment, no current questions. While we're waiting for any comments or questions, why don't we show the audience of how it is that Duke laser disc repair it is compared to all the other invasive spine surgeries.
I love it. Henry, thank you.
Of course.
That's a great idea. I'll just tell.
Yep.
Hello. We got your phone there? Come on. Folks, we're going to show you a video that Henry created that talks about this surgery and how it compares to other types of invasive spine surgery commonly recommended by surgeons around the world and pain management doctors around the world. These other procedures are most commonly known as microdiscectomies or discectomy, laminectomy, artificial discs, spinal cord stimulators, injections. None of these treatments provide real pain relief. They're all temporary and they're highly invasive and dangerous compared to what we're doing today, the Duke laser disc repair. This surgery has been proven to eliminate back pain. Our success rate with this procedure is 99.6% elimination of back pain for disc pain when people have discogenic back pain. That comes from our patients reporting the outcomes. Patient-reported outcomes. The most important outcomes in the world are patient-reported outcomes. Hi, I'm Dr. Duke Machen. We've just completed our free MRI review at Duke Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Duke Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Duke laser disc repair. We've been performing the Duke laser disc repair since 2006 here at the Duke Spine Institute. To date, we've had 0 complications. The Duke laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Duke laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Duke laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Duke laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Duke laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding and it heals within a few days. There is no need for narcotic painkillers. If you have the Duke laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Duke Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. All right, welcome back. And you've now watched our latest comparison video comparing treatments for back pain, with the Duke laser disc repair being the top best treatment available. The other treatments you can see, like laminectomy, doesn't even address the disc, even though the disc is the cause of back pain. That's why people get laminectomies. We had actually, 4 patients today with laminectomies and discectomies, including this one, where they went and had that surgery done and they end up having horrible back pain afterwards because laminectomy and discectomy doesn't fix back pain. So that's why we don't recommend it, because almost every patient we operate on has back pain. So you want to get rid of the back pain, you got to do a surgery that will get rid of the back pain. Now this patient has back pain not only from 2 discs, which we're fixing right now, but also from his SI and piriformis. He also had ischial tuberosity tendonitis. We did an injection yesterday to treat that, and I think he's feeling better today. Ischial tuberosity tendonitis is when the area on the bone where the hamstring attaches on your pelvis, it's called the ischial tuberosity, and the hamstring gets overstretched and irritated and causes a tendonitis there. All right, just not really happy with the laser performance. And I can't tell if it's because he's just got so much scar tissue here that it's not lending itself to be zapped away, but it just seems to be, I don't know. I mean, where are we at, 50? I mean, are you guys just trying to keep it as low as possible? What happens if we bump it up a little bit? Are we gonna get, yeah. No, the pulsing is fine. The hertz is fine. I'm considering it just to see. This isn't terrible, but it's not great. And it looks like it's probably more related to his anatomy. Go ahead and bump it up a little. Give us what, 55? Fine, 60.
We have a question
Sure.
coming from Mark on YouTube,
Uh-huh.
saying, I have 5 mm of overhang bilaterally of C1 on C2. Can you treat bone edema of C1 with your laser? How about calcified styloid removal with your laser? That would be epic.
Yeah, Mark, so I've never heard of a calcified styloid ever causing a problem. I've never heard of C1, C2 overhang causing a problem. The only kind of doctor that ever talks about those conditions is a chiropractor. And they take these x-rays that show a little bit of movement of C1 and C2, which is, by the way, normal to have overhang of C1 on C2. Normal. What you're describing to me is 100% normal. But they show it to you and tell you you need to go and do treatments with them for 6 months. And then you're paying out of pocket, and that's how they make their money. The reality is that's not the problem. So this is why I don't waste time talking to people like you about what's wrong, because you have no clue what's wrong. I know what's wrong, and I'm not going to sit here and guess what's wrong, okay? Because it's a waste of time. That's why we make these animation videos, so you can see there's 30 things that cause neck pain. Did you see in the 30 causes of neck pain video overhang of C1 on C2 as a cause? No, you didn't. That's because it never is a cause. Did you see calcified styloid process as a cause? No, you didn't, because the calcified styloid is never a cause of neck pain. Ever. Ever, ever, ever. You're talking about Eagles syndrome. You know how many Eagles syndrome I've seen in my career? It's almost probably 2 patients in my entire career of 30 years. That's how rare it is. Okay, so you're just sitting here talking about things that are unimportant and don't matter because some idiot told you they do, and you believe that idiot over literally a world-class neurosurgeon who all I do is cure people's pain. So I'm not going to engage anymore with you on these honestly ridiculous ideology you have that you've picked up from somewhere, because it's a waste of time for me and everybody else. Okay? If you want to know what's wrong, do the MRI review. Stop trying to guess. You're not going to guess. By you saying you can figure it out, you're saying to me, Dr. Duke, you are #1 in your medical school class. You went to a top university, UC San Diego. You busted your ass, studied all the subjects, organic chemistry, physical chemistry, biochemistry, cellular biology, genetic engineering. You did all that, plus you went to a top 20 medical school, USC, and you graduated valedictorian, which you studied more material in 1 year than I've ever studied in my entire life. Then you went to a 7-year #1 neurosurgery training program, and then you did 20 years of practice learning from your patients. And oh, by the way, I'm going to figure out what's wrong with my neck over you. I mean, that's what surgeons hear when patients come to them and tell them what's wrong. We hear somebody who is clueless, who will always be clueless compared to us. And unfortunately, you're going to call me arrogant, but it's really the patient who thinks they can diagnose themselves better than me. That is the arrogant person. Okay? So I'm not here for any other reason other than to help people get better. And I cannot help you get better by you telling me I have calcified this and 5 millimeters of slippage of that. And I'm not going to give you a diagnosis. So we're cutting you off, Mark. The only way I'm going to be able to help you is for you to go and do the MRI review and then do what I tell you to do. That's it. Okay? Sorry to be so tough on you, buddy, but you need some tough love. All right, we're just about done with this disc, and got 5 minutes, Dr. Berndes. We've already fixed L5-S1. We're coming up on L4-5, almost done. A lot of damage to these discs. This material I'm taking out here, none of it's normal. This is not a normal looking disc. As a matter of fact, you'll probably never see a normal looking disc in my operating room because I don't operate on normal discs. I operate on abnormal. But look at all that result of inflammation, shear destruction. Oh, there's the inflammation right there. You guys see it? That's exactly what I'm targeting the most, to get rid of this inflammatory tissue that's the source of the patient's back pain. Any other questions from our audience, except for Mark? Mark's not allowed to ask any questions.
At this moment, no current questions.
All right. Sorry, Mark. Not trying to be an asshole, but the reality is that I've already told you what you need to do. So do it. You increased the rate. I told you not to increase the rate. God. What? I told you not to increase the rate. I told you to increase the amount of energy delivered per pulse, right? Luis, am I imagining something? Huh? Did you not hear me say that? You can either increase the amount of energy delivered per pulse or increase the amount of pulse. I told you don't increase the amount of pulse. I want the pulse rate to stay the same. You did the opposite of what I wanted you to do. It's either A or B, and you chose, I told you no A, and you chose A. You still have a high pulse rate. I think you increased the pulse rate even more. Oh yeah. Oh, you did. Luis, I'm curious. Do you think increasing the pulse rate will wear out the fiber faster, or increasing the amount per pulse will wear out the fiber faster? I think the pulse rate. Yeah. Right? The more transmissions? Yeah. That's what I'm saying, increasing the pulse rate. All right. Well, the good news is we're just about done. Do I need to call Ariana back here, Nikki? I said, do you want me to call Ariana back here to help you? I mean, we're just about done at this point, but in the future, don't increase the pulse rate when we want more energy. Increase the amount of energy per burst. Okay. Right? Yes. I think we're pretty much done. I'm going to zap for another 30 seconds, Dr. B. 30 seconds and we're done. All right, Henry. Well, since we don't have any additional questions and we're finished, why don't you share with the audience one of our former patients that had the surgery done. We've got a lot of testimonials. Folks, if you go to our YouTube channel or our website, you'll see we have literally hundreds of patients that we've cured their neck and back pain. And Henry will put a link for the lower back testimonials. But watch some of their stories and check out this testimonial that Henry is going to share with you right now. I'm Dr. Duke Majan here with one of my patients. Now, you didn't travel too far. You're a Florida guy, right?
Yep, about an hour away.
And why did you travel to Duke Spine Institute? What brought you here?
I was having a lot of pain in my back, probably for about 8 years. I did a lot of research. I was tired of getting talked into just doing physical therapy, and it wasn't working. I tried chiropractic, that didn't work either. I kept researching on the internet, YouTube, for getting relief, and then I happened to come across Duke Spine Institute, and it got me so interested on his procedures. The techniques are really awesome. They're just a godsend, this whole institute. They're amazing. I got my surgery done yesterday, and I walked out with zero pain. Incredible. It is amazing the new technology they out there. And I would advise anybody to get a free MRI review. It doesn't cost anything, and he'll give you his perfect, honest opinion. It's just amazing, you know, and it's not a sales pitch. They're not trying to push anything. They're trying to get the information out there on the new technology. And it is so, I guess, innovative. It's crazy.
1/4-inch incision.
Yep.
Your surgery was done with the laser on your lower back. We found a tear that was causing all your pain, and we cleaned it out. And the whole surgery took us 30 minutes, and
Exactly.
you were out of here within an hour. So here you are 1 day later. You got a smile on your face.
Oh yeah, very much.
Now you're an engineer by trade. And how did you kind of think about the Duke laser disc repair from an engineering standpoint?
It's amazing technology, because I did research other ways of fixing the issue, and it was barbaric to me. So then when I saw this, and I saw the thousands of people out there that had all this done, probably more than that, the years of experience he has, I just felt so comfortable with the technology. And it's just amazing. The technology was so easy to do.
Well, we could have done a fusion too, and that would have caused more problems for you down the road. Scar tissue, muscle damage. Of course, with fusions, you're on pain pills for a month. Are you on any pain medication today?
Nothing at all.
So you had surgery yesterday, you didn't take any pain meds, and you have zero pain in your back and leg.
Exactly.
Well, congratulations.
It's
Is there
perfect.
anything you want to say to your fans out there?
If you have any problems with your back, you need to come here. His whole staff is amazing. From walking into the front desk, the nurses, the techs, all the doctors, and Dr. Duke is just amazing. And Henry. We have another
forget
Henry.
about Henry. We like Henry's
Yes.
here.
These people are incredible. They treat you with professionalism, and they exactly know what to do. They're just really cool people.
Well, you're welcome.
Thank you so much.
And you're the reason why I do what I do, because I could have retired years ago, but I love helping people like you get your lives back, and your wife.
Thank you. Yeah,
So,
she's happy.
congratulations.
Now I can get back to the honeydew list.
Oh yeah, not too soon.